now live. This is so awesome to talk about this. Love learning new things. And Doctor, so glad that you've come on the show.
Yes,
Gomes Medical. Doctor, first off, before we get going and get into what you've brought and everything, Gomes, excuse me, tell me a little bit about Gomes Medical.
Gomes Medical really was born out of, I was previously with the big box groups is what I call them. So like the Kaisers and the Sutters and those sorts of organizations.
Yep.
And unfortunately, we only get a very limited amount of time with people. You know, 10, 15 minutes is it.
Okay.
And then it's just churning people over and over and over again. And that just ate away at me. I mean, my patient care mantra is, I treat my patients like a member of my own family.
Wow, love
and
that.
I legitimately adhere to that. So I one day said, holy smokes, man, I wouldn't recommend my family be in this type of model.
Okay.
I got to get out.
And look at you, you're out.
So I got out.
Starting your own practice.
Yes, sir.
Is there a particular focus to your practice?
There is. We primarily, although we do adult medicine across the board, we have an emphasis on women's health, and in particular breast health, breast health education, and a bit of dermatology as well.
Okay, DPC, I know we were talking about that. What exactly is that?
It's direct primary care is what the acronym is for, DPC. And what it is it takes the insurance companies out of the equation.
Okay.
Wow. So it's a low cost, either monthly subscription or as needed PRN type visit. Totally removing insurance companies, so it's just back to what kind of old school doctor-patient relationship.
Okay, I love that.
So it's really kind of eliminating some of the hurdles that we might have seen in previous practices.
Exactly.
That's great. Yeah. That's really great. And so tell us about some of the materials that you brought here for us. I see you've got some diagrams, some other interesting literature. What are we learning here today, Doctor?
Today, in particular, my passion is breast cancer education and prevention. And one of the things, I have extra certifications in a bunch of different things that are unique. I'm the only California physician to have a certification with MammaCare as a clinical breast examiner, and then also as a global health breast educator. And my whole emphasis is reducing the incidence of breast cancer. Right now, the incidence is 1 in 8 women will get breast cancer. Like, that's too darn many.
Yeah, oh, absolutely.
I had to save myself there, but the one in 8 women, whereas say these also are not great numbers, but they're better. 1 in 19 would be lung cancer, or 1 in 25 is colorectal cancer.
Okay.
So the fact that we're not doing more is disturbing to me. Yeah, I mean, like, holy smokes.
You need to do more. Is this why you kind of got into that and focus more on that?
Absolutely. I wanted to find something where I can actually make a difference, and I know that I can with this. And the whole emphasis is on the clinical breast exam, and not just the clinical aspect of it, but the education part and teaching the patient how to perform their own self-exam.
That's what I was just going to ask. Obviously, the clinical exam, the education up front, super, super important. Some tips that you would give a viewer at home, maybe, that is just, curious about their own breast health. What are some things they can do easily at home before they come in and see you?
No, that's perfect. And like 40% of breast cancers that are detected are first detected by the patient. So, I mean, we have a real area to improve here. Some of the things, and this is meant to kind of simulate fat tissue or adipose tissue. Breast itself is mostly composed of adipose tissue, so it's kind of a silly statement to ask a woman, hey, do perform your own exam. What by far the most common response I get from my breast cancer patients is, no, I didn't know what the hell I was looking for.
Yeah,
like
exactly.
Everything is lumpy, bumpy, everything is kind of a odd contour.
Yeah.
That's why they've got to come see you, Doctor.
Yeah.
They got to come in here. Unfortunately, we're running out of time, but we need to have you come on back. We can talk a little bit more about this. We'll go up and throw some information here. Dr. Gomes, thanks for so much for coming in. I really, really appreciate it. I had no idea this even existed. This is good stuff.
It's fascinating, really important work. Thank you so much.
Gomes Medical Corporation. We'll be right back.